I still remember the day I decided to focus my final year thesis on the realities of street food vending. As a student of political science and economics, I had read about the Government of India's Street Vendors Act and the corresponding government order passed in Andhra Pradesh. Yet, every newspaper headline and on-ground anecdote suggested that these regulations had barely scratched the surface of the problems. Determined to understand the gap between policy and practice, I set out on a journey across my home state. My first stop was the bustling Kondapolli market on the outskirts of Vijayawada. Within seconds of stepping out of the auto rickshaw, my senses were overwhelmed. A heady mix of sizzling oil, vibrant spices, and the thick smell of garbage lurking just behind each stall. As I made my way through the narrow lanes, I tried to ignore the swarm of flies that seemed to follow me everywhere. As I walked deeper into the market, I could see the vendors working tirelessly, women in bright saris preparing food, men selling fresh vegetables, and children running errands. Despite the vibrant atmosphere, the market was dirty, unorganized, and lacked any basic sanitation facilities. The pavement was clogged with trash, and there was no proper drainage. Yet, the vendors seemed to be in their element, managing their small businesses with determination. I approached a vendor selling deep-fried snacks. His stall was small, with a few chairs set up for customers, and a large pot of bubbling oil. The vendor, a middle-aged man with a tired face, offered me a crispy snack, his eyes filled with hope. He didn't speak much but gave me a knowing smile. Perhaps he was used to the indifference of passers-by. I asked him about his challenges, and he sighed, explaining how difficult it was to make ends meet, especially with the constant threat of eviction by local authorities. As we talked, he shared how many of the vendors were dealing with constant harassment by the local police and had to pay bribes just to stay in business. He told me how some vendors even resorted to paying off local thugs to avoid their stalls being destroyed. I was taken aback by the complexity of the situation, how something as simple as selling food on the streets could be so laden with bureaucratic red tape and social obstacles. I approached a small cart where a vendor named Vera was frying spicy bhajis in reused oil. The battered chilies looked tempting, but the murky color of the oil made me pause. "Don't worry, sir," Vera said, noticing my hesitation. "People love my bhajis. No one has fallen sick, at least not that I know of." He chuckled nervously. Vera explained that he did not have access to clean water for washing his utensils, so he typically rinsed them with whatever water was available from the nearby tap, which itself was connected to an old pipeline. His daily sales hinged on speed and volume, not caution. If he spent money on fresh oil or extra water, his profit margins would evaporate. A little further along, I met Lakshmi, who sold homemade pickles and chutneys. She told me how she had lost half her inventory once due to rat infestations in the market. "The municipality doesn't collect garbage for days sometimes," she lamented. "It piles up, bringing rodents, roaches, you name it. They chew through the plastic sacks." Lakshmi's entire livelihood depended on these pickles, and any loss struck at the heart of her family's income. Her story illustrated how lack of proper waste disposal could have a devastating ripple effect on vendors already living on the edge. As I walked away, I couldn't shake the stories of these vendors, people who relied on their small businesses to survive, yet were constantly battling against the odds. They worked tirelessly to make ends meet, but without access to clean water, proper waste disposal, or safe working conditions, they were always one step away from losing it all. Next, I decided to speak with a few customers. Many expressed fondness for street food, praising its flavor and affordability, yet nearly everyone admitted being cautious about where they ate. A college student named Ajay described how he once fell ill after eating roadside pani puri. "I had severe stomach cramps for 3 days," he recalled, grimacing. "Doctor said it was some bacterial infection, likely food poisoning or diarrhea. And I'm not alone. A bunch of my friends got sick around the same time. We still eat street food, just a bit more carefully." It dawned on me how foodborne illnesses, whether typhoid, cholera, hepatitis A or E. coli or salmonella, were more than just statistics in a public health paper. They had tangible impacts on people's lives. The vendor might lose business, the consumer might lose wages, and local hospitals would be burdened with preventable cases. The realization of how deeply these foodborne issues were intertwined with the daily lives of people hit me hard. What seemed like an isolated issue was part of a much larger public health dilemma that touched everyone: vendors, customers, and the community at large. To gain a more official perspective, I visited the local office of the Food Safety and Standards Authority of India, FSSAI, in Vijayawada. The small waiting room buzzed with people seeking or renewing licenses. I managed to speak briefly with an official, who asked not to be named. "Enforcement is our biggest challenge," he said, tapping a desk piled high with files. "We issue guidelines and conduct periodic checks, but the sheer number of street vendors, many of whom operate in the informal sector, makes it tough. Access to resources is one thing, ensuring compliance is another." He also mentioned how the FSSAI had partnered with various NGOs to run awareness camps on safe food handling, yet attendance by street vendors was sporadic. Most simply couldn't afford to shut down their stalls for a day to attend training. Later that afternoon, I met Dr. Sunitha Reddy, a public health physician at the city hospital. She confirmed that foodborne illnesses contributed to a considerable portion of the hospital's outpatient cases. "We see hundreds of patients monthly with gastrointestinal infections," she explained. "Many can be traced back to unsanitary street food practices. If vendors had access to clean water and proper waste disposal, we could reduce hospital visits drastically. The costs, both human and financial, are enormous." I also spent time with a local dietitian, Ms. Lakshya Kulkarni, who underscored the long-term health effects of repeatedly consuming contaminated food. Children are especially vulnerable. Chronic diarrhea or parasitic infections can lead to malnutrition and stunted growth. This isn't just about an upset stomach, it impacts the future of our youth. As I reflected on these conversations, the true scope of the problem began to unfold. I realized that these health risks, while often invisible to many, were an urgent issue that needed immediate attention. The path forward required not just better enforcement of food safety standards but also a fundamental shift in how we view public health and street food. That evening, I sat down to write my initial observations, reflecting on the day's fieldwork. The more I explored, the clearer it became that sanitation was at the heart of the problem. Yet sanitation itself was an umbrella term covering multiple interlinked issues. Clean water scarcity. Vendors often relied on questionable water sources to wash utensils and prepare food. Even ice used in drinks could be contaminated. Poor waste disposal. Piles of uncollected garbage attracted pests, turning markets into breeding grounds for bacteria. Overflowing drains created stagnant water pools, raising the risk of waterborne diseases. Lack of cold storage. Meats and dairy were often left out in the open under the scorching sun, fast-tracking bacterial growth. Minimal hygiene practices, whether it was reusing cooking oil too many times or using unclean utensils, most practices were driven by cost-cutting rather than health considerations. By the end of the day, I realized the vendors themselves were victims too. Long hours in unclean surroundings took a toll on their health. Cases of skin infections, respiratory problems, and heat-related illnesses were common. Small wonder they struggled to meet any official guidelines when they barely had the resources to protect their own well-being. The gap between the Street Vendors Act and its practical implementation loomed large in my mind. While the policy was designed to protect livelihoods and regulate street vending, it was clear that the sanitation crisis urgently demanded more attention. My notebook was filled with quotes, interviews, and harrowing accounts from vendors, each recounting illness and financial setbacks caused by conditions beyond their control. Their struggles were tied to an infrastructure that simply wasn't equipped to handle the realities of street vending at this scale. As I jotted down my thoughts, the stark disparity between policy intentions and the practicalities on the ground was glaring. The Street Vendors Act might have been crafted with good intentions, but in reality, it had not translated into meaningful change for the vendors or their customers. Unsanitary practices remained rampant, and vendors were caught in a cycle of low wages, unregulated environments, and poor health. This led me to a simple, yet monumental question. If we already know that unsanitary street food contributes to disease outbreaks and economic burdens, why hasn't more been done to address it? I decided that the next logical step was to compare what I had observed locally with approaches in other states and possibly even other countries. I needed to understand if there were models where sanitation had been effectively improved. What made those policies and strategies work? Was it simply a matter of enforcement, or did it require a more fundamental shift in public health policy and infrastructure? As I drifted off to sleep, the day's sights and sounds replayed in my mind: the smell of rancid oil in the air, the sight of tattered garbage piles, and the voices of vendors clinging to fragile livelihoods in a system stacked against them. These images, along with the heart-wrenching interviews, fueled my determination. This thesis would be about more than just fulfilling an academic requirement. It would be a spotlight on an ongoing crisis that demanded urgent, effective solutions. Little did I know, my inquiry into one state's street food culture would soon take me across borders, into the corridors of policymakers, economists, and health experts. But for now, Chapter 1 ended with a stark realization: the foundation of safe, vibrant street food lies in sanitation, something still sorely lacking in Andhra Pradesh's everyday reality.